Home Improvement Week. We've been talking about upgrades that make our lives more functional, beautiful, and safe. But today we want to highlight a different kind of transformation that's improving lives in a much deeper way. UnityPoint Health has just completed a $14 million expansion of the Trinity Cancer Center in Moline. It's an investment that's answering a critical need in our community, where cancer rates are higher than the national average. Joining me this afternoon is Tricia Fisher, the Director of Oncology Services at Trinity Cancer Center. Tricia, welcome to the show. Thanks for being here today.
Thanks for having me.
Yes, we're so excited to talk to you about all of this. I mean, first of all, congratulations to yourself and your entire team on this expansion. So it's very exciting stuff. So Tricia, tell us a little bit more about why this was the right time for the Cancer Center to expand.
Yeah, so I mean, really our main goal is just to be able to meet the growing demands of cancer care here locally in our community. Over the past few years, we have seen a huge increase in the number of patients that we're seeing in our cancer center. So we've seen over 140% increase in our infusion center, which is where patients get their treatments done. We've seen about a 40% increase just in our overall visits to the cancer center with our patients. So obviously, you know, we need to be able to expand to meet those growing demands of the community and to be able to provide that cancer care right here locally in the community.
Yeah, without, you know, that need for them to do a lot of traveling. I mean, all of that means so much. So yeah, let's talk a little bit about what this expansion means for cancer patients and their families right here in the Quad Cities. What are they going to be seeing and noticing? Yeah,
well, a couple of the biggest things that we have to offer that are certainly patient and family satisfiers are that you can have all of your comprehensive care in one building, in one center. So that's very important, as you talked about with the travel. Oftentimes, you know, patients have their family members or their friends that are with them. And so being able to have this care, oftentimes they will have, you know, a lab or a testing on the same day that they see their medical oncologist or the radiation oncologist or have treatment. And that's all happening in one day. So you certainly don't want to have to be going to multiple different places for that. So it's nice to be able to have that all under one roof, very convenient for those patients. The other thing is that at our Moline campus, which is where our cancer center is at, it's a very peaceful, serene environment. And we were able to take advantage of the space that we already had, which is a lot of windows that overlook a very nice pond and water feature.
Look at that.
So it's a beautiful setting, and why that's important is, again, these patients, you know, oftentimes have very long treatment times, and so much better setting for them to be able to look out the windows instead of looking at a, you know, a wall or something like that. It provides for a lot of entertainment because there's a lot of wildlife, ducks, geese, there's baby goslings right now, so there's always entertainment going on out around the pond. So that's just nice for not only them, but also their caregivers that are with them for long periods of time to just be in a nice, peaceful setting, especially during stressful times.
Absolutely. And, you know, and not having to run around to different locations, that is huge, I mean, for any family. Okay, so let's talk a little bit about what's new in this expanded facility. I mean, we just saw that really peaceful looking setting right there. But you also have added things, like you have more infusion chairs, you have private infusion rooms as well. You've been able to add a lot of stuff.
Yep. So we have over 10,000 square feet now of space that we were able to expand or renovate the existing space. And really kind of some of the major things, as you pointed out, are just more treatment chairs. The private infusion rooms are important because sometimes people need, you know, private treatments. We've also been able to add more exam rooms to our clinic space to be able to treat more patients. We have our more efficient, you know, nurses stations that create better workflows.
Which is wonderful.
It is. And just, you know, all of the departments work so closely together that taking down the walls and having one big cohesive environment was a huge goal of ours. And it's just nice to be able to see our staff kind of moving from one place to the other, because oftentimes they're being treated by, you know, the same team of people.
Yeah, that's huge. And this is also great for recruiting and retaining providers, which of course we want only the best, you know, for cancer care here in the Quad Cities. And so all of this is going to help with that.
Absolutely. Yep. And our, you know, we already have a wonderful team, but as we talked earlier, with the growing needs, we also need to expand our team. So to be able to provide this environment for them where they can come to work out of in a peaceful environment, it certainly has helped. It's already helped us with the recruiting, but it's just a great environment for them to come to. And again, just being able to have cancer is a team sport, so it's not just the physicians and advanced practitioners, but all of the support services like our social workers, dietitians, pharmacists, having them all work out of the same space as a cohesive team is very, very important for our team and for the patients as well.
Absolutely. I can only imagine. Well, if you want to learn more about the newly expanded Cancer Center and the services available there, visit them at the website on your screen right now, or give them a call at 309-779-4940. Tricia, thank you so much for coming on the show today, and I think more to come with that. I can't wait to just get some more up-close looks at everything you guys are doing there.
We'd love to have you.
Thank you.